Today's class is about hypertension and hypotension. Before knowing what is high BP or hypertension, you must know what is normal BP. Normal BP is around 120-80 millimeter of mercury. But hypertension means when the systolic pressure, that is 120, rises above 140. I mean when the BP become 140 systolic or above 90 millimeter mercury diastolic, what happens is that the patient have hypertension. While thinking about hypertension, hypertension are of two types. One is primary hypertension and second one is secondary hypertension. Normally, commonly you are talking about what? Primary hypertension, while the secondary hypertension is is secondary due to some diseases, renal or anything like that. Now we can deal with the primary hypertension. Primary hypertension, there is no cause, there is persistent hypertension. It is of two types. One is benign hypertension, another one a serious condition, malignant hypertension. When you think about benign hypertension, it is non-problematic but it is persistent. When we think about malignant hypertension, it is rapid, severe, accelerated, even fatal. It can affect kidney, it can affect heart, it can affect brain. More than that, it can even affect the tunica intima of blood vessel. Okay. Now may I tell you what are the diseases that causing secondary hypertension? The diseases that are causing secondary hypertension we can classify into CVS problems, endocrine problems, more than that renal problems, neurogenic problems, problem during pregnancy. So let me describe what are the CVS diseases that causes problems in hypertension. The CVS cause that causes for example atherosclerosis. When atherosclerosis, that will increase the BP, that will increase the peripheral resistance, so that increases the BP happen. Then coarctation of aorta means narrowing of aorta, and the endocrine causes that include one pheochromocytoma, that is tumor in the adrenal medulla at producing large amount of catecholamines like adrenaline and noradrenaline. And more than that, Cushing syndrome is there. Cushing syndrome means the overproduction of steroid in adrenal cortex, and the renal factors that causing our secondary hypertension include stenosis of renal artery, and more than that, tumor of JG apparatus resulting in the production of angiotensin II, large amount of angiotensin II. And the neurogenic factor that causes the secondary hypertension include increased intracranial tension, lesion in the tractus solitarius, more than that, cutting of nerve fiber to the carotid body. And in pregnancy, there are conditions like preeclampsia that are increased BP. Okay, now what will be the damages or problems with the hypertension? There will be MI, there will be left ventricular failure, there will be renal failure, there will be cerebral hemorrhage, more than that there will be retinal hemorrhage resulting in loss of eyesight. What are the medicines to reduce hypertension? There will be beta blockers that block the beta receptors, resulting in the blocking of transmission of adrenaline and noradrenaline from sympathetic fibers. More than that, there is alpha blockers, just like beta receptors, there will be alpha receptors also. So beta blockers, alpha blockers, and there will be calcium channel blockers and vasodilators. Before that, diuretics make the diuresis and prevent lower the blood pressure, and ACE inhibitors, as you know, and angiotensin receptor blockade drugs. Thank you for watching me.